So ethics in research. Ethics in research. Um, in our practice, we have what we call ethics, right? That is what is wrong or what is right based on a body of knowledge, right? Not just based on your views, but based on a body of knowledge. So in nursing, we have what is considered right and then what is considered wrong in or the do's and don'ts, right? In practice, in nursing practice, in ethics to in research to you have the do's and then the don'ts, right? So we are going to look at what can be done in research and then what cannot be done, right? Otherwise, someone can just get up and then decide to conduct any research, not thinking about whether it will affect the participants or not. Okay, so before you conduct a research, you have to obtain an ethical clearance from a body, right? An ethical review board, right? In Ghana, there are several of them. I'll talk about only 3 of them. Yes, so you can't conduct a study in a field without getting permission from these review boards, right? So the institution will decide where you get your ethical clearance from, right? So you can get it from Noguchi. We have one at Legon. It's known as the Noguchi Memorial Institute of Medical Research, right? So the institutional review board at Noguchi, right? You can get your clearance from there. And then you can also we have one review board at Dodowa Health Research and Institutional Review Board. You can also get your ethical clearance from there. And then Ghana Health Service also have a review board, so you can get your ethical clearance from there also. And I think Kolebu also have DS, right? So you decide where most of the time the school will decide so that you all get your clearance from one review board, right? Yes, and then you can only do this when your proposal is done, right? So we send your proposal there. They have a guide. Each review board has a guide that you have to follow, right? So you fill their forms and then you attach your proposal and you send there, right? So they also review it to make sure your study is not going to cause any harm to your participant before they approve it. And when they approve it, you can now go to the community or the school or the field where you are conducting your study to conduct the study, right? Some authors in 2011 discovered that there are 4 major ethical issues in research, which are informed consent, maintenance of anonymity, confidentiality, beneficence, and then respect for privacy. Another author even added autonomy to it. So let's look at it and then how you can maintain this. Informed consent, right? It's just like you are going to give injection and then you tell the patient, I'm coming to give you an injection. This injection is for pain, right? I'm going to give you on your buttocks, or it can be given on your buttocks, on your shoulder. So you tell the patient on your thigh, you can choose which of the sites you want, right? So inform the participant about the study, the purpose of the study, why you are conducting the study, right? So inform them, seek their consent first, right? And then if they refuse, so tell them that they are at liberty to exempt themselves from the study. So if they refuse, allow them, right? Don't force them to partake in the study. And then explain the purpose and the benefits. Most of the time, if you explain the purpose and the benefits to them, they will willingly participate in the study. And then you have to also have a consent form, right? That if they agree, just like the one we have for patients when they are going for surgery, they sign to indicate that they have agreed to undergo the surgery. So you have a form, a consent form, which indicate that participants have agreed to participate in the study. So by signing or thumb printing, it's an indication that they have agreed to partake in the study, right? And then beneficence. In ethics, it refers to doing good to your participant and not causing harm, right? How do you ensure that your study does not cause harm to your participant? You do that by telling participants that in case they are emotionally traumatized by any of the questions that are asked or that is asked, the participant can skip the question, or if they feel like not continue again because it's causing them to be emotionally disturbed, they can reschedule the interview, or they can even stop partaking in the study without any consequences, right? And then in order to ensure the beneficence, you have to tell them that they are at liberty to even opt out after they have agreed to partake in the study. And then you have to conduct the study in their preferred language, right? And then privacy, yes, especially if you are going to conduct breast self-examination or experimental studies, etc. These studies you should provide privacy, right? So that especially when the nakedness of the person will be exposed, you have to provide privacy, and then you have to make sure that no one is around, is close, right? When you are conducting the interviews and all that. Autonomy, you allow the patient to make decisions, right? So you don't have to decide for the patient. So the location should be chosen by the participant, right? And then the time that you want to conduct, so allow the patient to make those decisions, right? That means that you are maintaining the autonomy of the patient. And if the patient decide that I don't want to partake in the study, even after I've signed the consent form, allow the patient to exempt himself or herself from the study, right? And that is what we term as autonomy. Confidentiality, respondents to be told not to mention their names, right? So you tell them at the beginning that you are going to keep their information confidential, right? And then they should not mention anything that will reveal their identity in the interview. So sometimes they are giving pseudonyms, right? Probably 1, 2, 3, 4, or A, B, C, D, or Ama, Akuya, things that other people cannot recognize, used to identify them, right? And then you have to also tell them that whole or part of the information collected will not be made available to anyone except the researcher and then the supervisors, right? So you tell them that you have supervisors who are making sure you are doing the right thing. So they are the only person or the only people who will have access to your findings, right? Or the interviews. But it's just for academic purposes, and then their identity will not be made known to anyone, the supervisors or any other person, right? And then the confidentiality also means that your questionnaires, right, or the interview guide or the interview, the recorded interview, will not be made available to any other person apart from you, right? So you tell them that you keep the recorded data with a password on your laptop so that nobody can have access to it, even if they get access to the laptop. Or the recorded data will be kept under lock, right? The audio recorder will be kept under lock, right? Most of the time you tell them that you keep it, those information are kept for 5 years. If no issue arises, then you can discard it after 5 years, right? So you have to inform them about these things. So this is what we term as ensuring ethics, right, in research, or ensuring that the right thing is done in research. Okay.